My client presents with a slight asymmetry in the height of the pelvic bones, and we're just going visually here. When I look at the undersurface of the sit bones, comparing side to side as best as I can visually, I see symmetry. I don't know if the camera will capture this or not, but I see asymmetry when I dig into the top of what I call the iliac shelf. And the iliac shelf, the ilium is curved like this, and at the very midline on each side is a flat little portion, and I name that the posterior iliac shelf. And so it's this flat, somewhat flat portion right there that I'm speaking of. And when I palpate and compare sides, I wish I had laser vision, but I don't. I'm just, just a regular Joe, regular human being here. But I see a distinct asymmetry. I see this as being lower by maybe as much as a ½ inch. And there is no twisting of his pelvis. If there was a twisting, there would be an altered movement. Someone might say, well, this left ilium could be a downslip, except this motion would be blocked, and this has good mobility. And then someone might say, well, the right ilium is stuck in upslip. Well, no, because I can take up the slack and I can spring that structure. I can induce movement through that structure, so it's not stuck in upslip. And someone might say, well, it's rotated anteriorly on that side. But again, if that was true, then this movement would be blocked, and it's not blocked. So yesterday, we treated some motion deficits in the pelvis, but he does not have that today. And the point that I'm trying to make is this hemipelvis at the factory is shorter than the right hemipelvis. And I'll show you how that manifests when he sits. But I want to demonstrate to you that his leg lengths are equal. Let's have you lie on your back, please. And I'm not sure the camera angle is going to capture this. Some people use a tape measure to measure from the front of the pelvis down to the medial malleoli, but using a visual, these look symmetrical. And I also like to look at the heels coming together, and those look symmetrical. We're also going to bend his hips and knees with his feet flat. And in spite of how the camera appears, when I observe the front of the knees, the front of the tibia, front of the patella, they seem rather symmetrical. And when I look at the height, comparing side to side, the height of that is just slightly asymmetrical. He's just slightly higher on the left side. But when we get him sitting, there's a greater difference. And another point that I wish to make is that sometimes this is used as a screen alone without looking at them in sitting. And what you're missing here is, of course, the height of the pelvis that you'll capture when the client sits. So let's have him go sit in a chair, and I'll show you how the side-to-side discrepancy becomes more pronounced. So bear with me, the cameraman. Now I'm sure that the camera image is not going to be equal to my image, to what I see rather. But in sitting, I see asymmetry of the pelvis. And that's actually pretty subtle. He looks lower on the left, and that's congruent with what we saw in prone. And I distinctly see this femur being more superior and this femur being more anterior. Distinctly so. And he sees that as well. I'm blaming this asymmetry on the altered shape of his pelvis, not on a leg length difference. And I looked at you earlier, we didn't film it, but I looked at patellar height in standing, and I looked at patellar height in supine, and they were symmetrical. In sitting, now they're not symmetrical. So again, this all points to an asymmetry at the pelvis, and the question is, what do we do about it? And for people with severe scoliosis, we do many things to make the chair match the posture of their body so that they're more comfortable. Because otherwise the chair is trying to force an asymmetrical body into a false symmetry. Okay. So what I do is I use these padded foam rolls that we make, and I place that under the trochanter. It's good to experiment on both sides. So we'll put it under the right trochanter, and so it's placed horizontally this way, okay, right under that bumpy trochanter, and that creates much more symmetry in terms of the height of the femurs and in terms of the length of the femurs. But more important with how something looks is the question of, does this make him feel different? And if it did not change the way he felt in a positive direction, then I wouldn't worry about it. There are some people with some asymmetry of the pelvis in sitting, and they find no real benefit from sitting on this. How do you feel when I put that under your trochanter?
It's hard to tell right now. I've been sitting on it for, I don't know, maybe 2 minutes now.
Yes,
And I don't feel any difference.
Okay.
Yeah.
So if we take it out.
Now I feel like I'm leaning to the right.
Okay.
And there's a little more pressure on my right lower back.
Okay. So let me put it back under there.
Okay. Yeah, feels more symmetrical.
Okay. So you feel more symmetrical.
Yeah.
Alrighty. And what happens if we put it on the other side?
Well, it keeps sliding out, but I feel off.
Yeah.
Like I'm moving to the right a little bit.
Okay. All right.
Yeah.
Well, based on the feedback that you've given me, I think that this simple device is very worthwhile.
Okay.
Especially for long-term sitting. So I think you're one of the folks in which it is helpful.
Okay.
You know, if you forget it when you travel or something, you could roll up a towel, a hand towel, and put it underneath there.
Okay. Why isn't this flat? Why wasn't this made flat to put under the...
Because we bought them as a product that was already made.
Okay.
I couldn't find one, and when I cut them flat, they're not high enough. I actually did make one flat, but I wasn't happy with the outcome. So what I did was, because it's a pre-made product, all I could do was slice some of that off of it.
Yeah.
So try that and tell me what you think of it with it having a flat bottom.
It definitely stays under.
Nice.
Better.
Nice.
Much better.
Okay.
I'm not like worried about it rolling out.
Sweet.
So,
and the correction is still good. I don't see any significant asymmetry. So yes, so then you will use the flat one. And I'll have to reconsider. It's a little bit of a hassle to make them, to cut that flat part off.
Well, also the underwear idea.
Yeah, you were talking about underwear, the pocket that you could put it there and it would stay there.
Right.
But
Like a padded underwear.
yeah,
Custom underwear.
sure.
Signature Shield.
I'll let
underwear.
I'll let you run with that.
Okay.
Okay, I'll let you make the money on that one. So I'll stop filming now. And so my point is that
better.
people with an asymmetrical pelvis will sit differently than they appear in supine. But in prone, we found the asymmetry of development of the height of your pelvis. And in sitting, the chair tries to force you into false symmetry, which is abnormal for your body. It's unnatural. And so using a small support under the trochanter can be helpful in improving long-term sitting comfort. That's my point.
Okay. And then as far as drumming goes, just trying to figure out how to apply this to drumming, since my right kick foot is going to be kicking and then my left foot is my hi-hat foot.
Right.
So how do I keep this under here?
How do you keep it there? I would glue it to a pad of craft foam.
Okay.
So you go to like Hobby Lobby and pick up a piece of 1/4 inch thick black craft foam. And that's a very dense foam. And I would glue that onto it.
Okay.
And then your weight bearing on both sides, your sit bones are weight bearing on that craft foam, so it would stay put.
Okay. Okay.
Good. So basically, by sitting on this thing, it maintains the posture that your pelvis has when you're laying down, and it maintains the same asymmetry that you have when you're standing. It puts that in the sitting context, and now the chair is not trying to force you into a false symmetry, and therefore you're more comfortable. So, wow, we're at 12 minutes. That's a long video. I'm going to stop right here. Thank you.